Hi everyone, this is a message for our staff and volunteers. It's Justine Collier, CEO at Rise on the 9th of February. I've got some things to update you with about COVID, so I'm just going to read you through a few points. The first thing is you'll probably know that as of 12:01 on the 8th of February, some new COVID protocols came through for tracking, testing, reporting and isolating. What we are doing is putting on our FAQ intranet page some flow charts to help you understand what to do if you are a close contact, if you test positive, if you need to isolate, etc. So this combines our internal processes with the government requirements in a way that we're trying to make it as easy as possible. They're all fairly clear at the moment, and we hope for them to be up by close of business today, the 9th of February, but we still do have some things to work through, such as the government's definition of a critical worker, because there are different rules that apply to them. What we do ask you to do as well is continue to check the government website, which lists the exposure sites that show where previous cases have been each day that you're working for Rise. And they will give advice about whether you just need to monitor for symptoms or isolate immediately. But if you go to that website, you will find out what all the exposure sites are. There is a lag of a couple of days of those, so it's not fully up to date, but it's just one tool in helping us understand where the exposure might be, as well as if you're contacted by a tracer or you yourself know that you have symptoms or have been in close contact. The next thing we want to talk about is PPE and testing. So we continue to provide all of the PPE you need for the circumstances you're in at the time. As Omicron goes through the community, we know that the PPE requirements will change. So we will make sure we've got the correct PPE for you, for the circumstance, and provide training on how to put it on, take it off, and dispose of it. In terms of testing, there will be clear guidelines about what circumstances to test in. The gold standard remains the PCR test, which you can get at a testing centre or many other places. However, in certain circumstances, if those aren't available, there will be the possibility of using a rapid antigen test, a RAT test. And in cases of some circumstances with critical workers, a RAT test is mandated, not just optional. So we will supply RAT tests to our critical workers and encourage other people to use the PCR tests, but we'll continue to try and secure more RAT tests as we go. There are shortages of RAT tests in some circumstances, but if you are able to purchase some yourself, it may be that they are a tax-deductible item, but that's something you will have to follow up with from your personal financial situation. From 14th of February, we are encouraging or asking people who can work from home to work from home for the time being. If you or we feel it's better for you to be able to work from the office because of the nature of your job, or because for any reason you don't or can't work from home, discuss this with your LG member and we'll make sure that we accommodate you. So from the 14th, we'll be moving to a social distancing model in our offices, which means every other desk will be blocked off. Which means that on the Robin booking system, every other desk will be blocked off. So do make sure that if you've already booked a desk from next week, that you go in and check they're still available. We'll also be moving to a maximum number of people per meeting room spaces, and we'll be able to confirm what those numbers are, a bit like COVID previously. And what we do understand is for those who are working from home or will be working from home, that most of you, by far the majority of you, already have the equipment you need. But if for some reason you don't, email Simon Robbins directly and we can help you out there. And we'll also move to holding meetings on Teams where possible. That's from next week. In terms of, we know that there will be a disruption to business as usual. It's inevitable with Omicron coming through. So there are some things, though, that regardless of COVID, we need to continue doing. And some of those corporate functions like payroll, distributing PPE, making sure we meet certain government contract requirements. So we will continue doing those, but we are lucky also that we do a number of discretionary projects or important projects that can be paused temporarily, and that can free up some staff to move across the corporate areas. We also know that in terms of service delivery, there will be obviously staff who are unwell and need to be off work and or isolate. And in that regard, we know that which of the essential services that we absolutely have to keep running, and again, which of those that we might be able to pause to be able to have staff move around a little bit within the services. Again, just like we did with COVID back in 2020. But we, again, will go through all of that at the time. We're well planned, ready to go, and we'll adapt to the situation as it emerges. The final thing is obviously, from my perspective, you are our most important part of Rise, because without all of you, we cannot deliver the services that we exist for. So it's really important that we keep you safe, well and happy. And that's more than just the PPE or sort of manual handling or all of those workplace health and safety physical things. And it's also about how you're going just within yourself and how people respond differently to these situations. And some people can find them distressing, stressful, etc. So our biggest ask of you is just let us know at the minute you think you are struggling with any aspect of work, and we will absolutely be able to support in a range of different ways. So don't struggle on bravely. We've all been through this before, and you were beyond excellent when it first came out, when none of us really knew what we were doing. We've now armed with a bit more knowledge and experience, so I think I've got full faith that we will again get through this, and hopefully by the time this is all over, we will actually start enjoying the benefits of more freedoms and the things that we've had to put on hold for a couple of years. Keep safe, keep well, and we'll continue to update you with information as it comes through. Thanks so much. Have a good day.